Hi, Dr. Preeti. As we are talking about puerperam today and postpartum, the stressful life the females are having these days and the nuclear family. How do you say the mental health challenges the woman is facing after delivery these days?
About 70 to 80% of women after childbirth experience postpartum blues or baby blues. Because you have delivered, be it normal or C-section, your body undergoes a lot of changes. So you can have a lot of body pain, your sleep will be disturbed, you have a baby to feed and you have a lot of guests coming in. So the main focus is on the baby. So it is very mentally distressing for the mother. So during this time, you can develop postpartum blues, that is, you will have mood swings, irritability, sadness or anxiety, sleep disturbances, and sometimes even crying without any reason. So this can develop within 2 to 3 days after birth and usually gets better within the first few weeks with proper emotional support by the family and doctor.
Do you think a woman with postpartum depression can treat it on her own at home?
No, it is not possible because postpartum depression is very severe. The symptoms which you experience during depression are quite severe and distressing to the extent that sometimes even you can get thoughts of harming yourself or the baby. So definitely you need to get in touch with a mental health care specialist. Without treatment, depression can go on for months and years, which disrupts your activities of daily living.
Okay, so do you think all the women who are having these symptoms, do they need medication or are there any other therapies for it?
As I said earlier, postpartum blues doesn't need any medication, just proper emotional support. The patient will be out of it. But if it's depression, generally, if it's mild or moderate severity, we do give them therapy, that is counseling, and give a trial. But if the patient is not improving or if the symptoms are very severe, then they definitely do need medications.
How do you address the concerns of the mother? Like she's concerned that the medication can affect her baby because she's breastfeeding and all. So how do you address it?
We do have certain medications which are reserved for pregnant and breastfeeding population. So it is safe to use during this period. And generally we advise the mother, once the medication is taken at the night, not to breastfeed the baby for the next 6 to 8 hours at least. And the next day morning, they can squeeze out the breast milk from both the breasts and then they can start feeding the baby throughout the day. And generally advise not to feed at the night because they are put on medications. By this way, they can safely take the medicines.